Welcome to the Psychology and Physical Training channel, Unraveling Cardiovascular Disorders. Do you ever wonder why understanding cardiovascular disorders is crucial for not only health professionals but also for psychology students? Well, let's take a closer look. Cardiovascular disorders, as some of you may know, refer to a spectrum of conditions that affect the heart and blood vessels. It's a pervasive health issue around the globe. From coronary artery disease, which is the most common, to rarer types like congenital heart defects, these disorders come in many shapes and sizes. Now, what makes these disorders so prevalent? A myriad of risk factors contribute to their onset. Smoking, for instance, damages the lining of your arteries, leading to a buildup of fatty material that narrows the artery. This can cause angina, a heart attack, or a stroke. Obesity is another significant risk factor. Excess weight puts pressure on the heart, forcing it to work harder to pump blood throughout the body. This strain can lead to conditions like heart failure, where the heart can't pump blood as well as it should. Lack of physical activity and an unhealthy diet also play critical roles. A sedentary lifestyle combined with a diet high in saturated fats, trans fats, and cholesterol can lead to high blood pressure, which significantly increases the risk of heart disease. But where do psychologists fit into all this? Well, being diagnosed with a cardiovascular disorder can be a life-altering event, often leading to significant psychological distress. Psychologists can provide support for these individuals, helping them manage the emotional and psychological aspects of their diagnosis. From teaching stress management techniques to providing therapy that helps patients navigate the emotional toll of their condition, psychologists play a crucial role in the patient's journey. They also assist in behavior change, helping patients adopt healthier lifestyles to manage their condition better and prevent further complications. This can include promoting physical activity, encouraging healthier dietary choices, and assisting with smoking cessation. Understanding cardiovascular disorders allows psychologists to assist in the patient's journey, enhancing their quality of life. It's not just about the physical aspect, but the mental and emotional well-being too. So you see, unraveling the complexities of these disorders is indeed a vital task. A silent killer. Moving on to another critical health concern, hypertension, often known as the silent killer. But why? Hypertension, more commonly known as high blood pressure, is a condition where the force of the blood against artery walls is too high. This silent killer sneaks up on its victims, often without any significant signs or symptoms. Some individuals might experience headaches, shortness of breath, and nosebleeds. However, these symptoms usually don't occur until high blood pressure has reached a severe or life-threatening stage. This is why regular checkups to monitor blood pressure levels are vital. Now let's talk about risk factors. Age plays a significant role in hypertension. As we grow older, the risk of developing high blood pressure increases. Family history is another major factor. If your parents or grandparents have had hypertension, you are more likely to develop it as well. Race can also influence the risk of hypertension. Studies indicate that hypertension is more common in people of African heritage at an earlier age compared to individuals of other races. But it's not all down to genetics and age. Lifestyle choices significantly impact our blood pressure. A diet high in salt and low in potassium can lead to hypertension, as can physical inactivity and obesity. Regular exercise, a balanced diet, and maintaining a healthy weight can all help in preventing or managing hypertension. This is where psychologists step in. They play an essential role in stress management and lifestyle modification. Chronic stress can contribute to hypertension, and psychologists can provide techniques to manage this stress. They can also help patients make the necessary lifestyle changes, such as quitting smoking or adopting a healthier diet, to lower their risk of hypertension. Psychologists can further assist in managing the emotional impact of a hypertension diagnosis, helping patients navigate through fear or anxiety and encouraging adherence to treatment plans. With a better grasp of hypertension, psychologists can guide patients towards healthier habits and stress management techniques. Breathe easy. Next, we delve into asthma, a condition that can drastically impact one's quality of life. Asthma is a chronic disease that inflames and narrows the bronchial tubes in the lungs. This inflammation can cause bouts of coughing, shortness of breath, chest tightness, and wheezing, particularly early in the morning or at night. Now let's talk about triggers. Triggers for asthma are not the same for everyone, and they are not always obvious. Common triggers include allergens like dust mites, animal dander, and mold, Respiratory infections and physical activity can also trigger an asthma attack. However, asthma doesn't discriminate. It can affect anyone regardless of age, gender, or lifestyle. But certain risk factors can increase the likelihood of developing asthma. Genetics plays a significant role. If a parent has asthma, a child is more likely to have it too. Obesity is another risk factor, with research suggesting that excess weight can increase the severity of asthma symptoms. Smoking, whether firsthand or secondhand, is also a significant risk factor, as it can damage the airways and trigger asthma symptoms. Living with asthma can be challenging, and that's where psychologists come in. They play a crucial role in helping patients cope with the anxiety and stress that comes with an asthma diagnosis. By providing psychological support, they can help patients manage their symptoms and navigate through their daily lives with less fear and more confidence. Psychologists can also assist with behavioral interventions, such as teaching relaxation techniques and stress management skills. They can help patients understand their condition better, recognize their triggers, and learn how to avoid them. They can also provide support to families, helping them understand how to best support their loved ones living with asthma. By understanding asthma, psychologists can provide invaluable support to patients, helping them live fuller, healthier lives. The therapeutic role of psychologists. Now that we have a grasp of these conditions, let's delve into the therapeutic role of psychologists. Psychologists do more than just sit and listen. They play a crucial role in the treatment of cardiovascular disorders, hypertension, and asthma. Their work extends beyond the couch to encompass a range of therapeutic interventions that can dramatically improve patient outcomes and quality of life. One of the primary therapies psychologists provide is cognitive behavioral therapy, often referred to as CBT. This approach helps patients identify and manage the thoughts and behaviors that contribute to their health issues. For instance, it can help a person with hypertension understand the stressors that raise their blood pressure and develop coping strategies to manage them. CBT can also assist individuals battling asthma to control their anxiety around breathing difficulties, thereby reducing the frequency and severity of their attacks. Then there's stress management, another key area where psychologists lend their expertise. Chronic stress is a common trigger for many health problems, including cardiovascular disorders and hypertension. Psychologists teach techniques such as mindfulness, meditation, and progressive muscle relaxation to help patients reduce stress levels, thus mitigating their risk of health complications. Lifestyle counseling is yet another domain where psychologists can make a significant impact. They guide patients in making healthier choices, which can be instrumental in managing these conditions. This may involve encouraging regular physical activity, advocating for a balanced diet, or helping patients quit smoking. The positive changes in lifestyle can lead to improved physical health, stronger mental well-being, and a higher overall quality of life. But perhaps the most important role psychologists play is providing emotional support. Living with a chronic health condition can be emotionally taxing. Psychologists offer a safe space for patients to express their feelings and fears, helping them navigate the emotional landscape of their health journey. Psychologists play a vital role in the management of these conditions, offering a holistic approach to patient care. This therapeutic role is about more than just treating symptoms. It's about helping patients live their best lives despite their health challenges. Key points. As we wrap up, it's important to summarize the key points about each condition and the role of psychologists. We've delved into the intricate world of cardiovascular disorders, hypertension, and asthma, each presenting its own unique challenges and risk factors. Cardiovascular disorders, first and foremost, represent a range of heart and blood vessel ailments. They are often silent, lurking undetected until they manifest in severe ways. Risk factors such as unhealthy diets, tobacco use, alcohol abuse, and physical inactivity contribute to their development. And it's here that the role of a psychologist becomes critical, helping patients navigate lifestyle changes to reduce these risks. Then we have hypertension, often termed the silent killer due to its lack of noticeable symptoms. It's a condition that can lead to severe health complications if left unchecked. Stress, excessive salt intake, obesity, and a lack of physical activity are some of its key risk factors. Psychologists play a pivotal role in helping patients manage stress and adopt healthier habits, directly impacting their blood pressure levels. Asthma, a chronic lung disease that inflames and narrows the airways, can significantly impact the quality of life. Allergens, smoke, pollution, and even stress can trigger asthma attacks. Once again, psychologists step in to help patients cope with the psychological impact of the condition, as well as to manage stress, a known trigger for asthma. The therapeutic role of psychologists in managing these conditions cannot be overstated. By understanding the psychological aspects of these conditions, they can provide emotional support, help patients cope with their diagnoses, and implement behavioral changes to improve health outcomes. This includes stress management techniques, cognitive behavioral therapy, and lifestyle counseling. Remember, psychologists play a crucial role in healthcare, contributing to the overall well-being of patients. The more we understand these conditions, the better we can serve those who need us. And if you like this video, do not forget to subscribe to the Psychology and Physical Training channel for more videos. Thanks for watching.